Hello and welcome to Family Matters. Thank you so much for joining us. On this program, we discuss various issues that affect families and individuals. And today we're discussing how to cope with postnatal depression within a family. To help me discuss this issue, I have Liz and Mike. Welcome.
Thank you.
Thank you.
So, Liz, tell me, what is postnatal depression?
Postnatal depression is a cluster of depressive symptoms that are experienced by a woman who has just given birth, and it is shown for a reasonable time, like it can take weeks, months, and years.
Now, does every woman who gives birth go through this, or what happens?
It's not given that every woman who gives birth goes through PND. I'll just say PND for the sake of discussion,
Mm-hmm.
meaning postnatal depression.
Mm-hmm.
So it's not every woman who goes through PND because it has a lot of pressures or things that take place that may lead a woman to suffer PND.
All
So
right.
not every woman suffers from PND because it can be through the challenges within the environment that may lead that.
Right. So since we've established that it's not every woman who goes through it, how then does it manifest itself? How can you see that okay, perhaps this person has PND?
There are quite a number of symptoms that we need to be aware of. And these symptoms, to be very clear, they need to be persistent within at least a period of a month and above. And they have to be, people have to be sure that they've been persistent for that period.
Mm-hmm.
Otherwise, if it is a feeling a woman feels for 1 day or 2 days soon after delivery,
Mm-hmm.
that doesn't necessarily mean that they are going through PND.
Right.
So it has to be at least within a period of about a month, and it leads to malfunctioning of this woman. Their way of functioning is highly affected significantly. That's when you can see that this woman is going through PND.
When you say function, you mean like on a day-to-day basis,
Y-
day-to-day activities.
Yes, or the
Okay.
way they used to do things is now affected.
Right.
And sometimes there's quite a lot of symptoms which we are going to
Of
discuss
course.
that will show that this is some of the symptoms that indicate that this woman is suffering from PND.
All right, Mike.
Mm. Yeah, basically the physical well-being of this woman is grossly affected. Like Liz is saying, there may be loss of appetite.
Right.
Eating disorders may come in. They may also have insomnia or sleeping disorders that may also be associated with the manifestation or presentation of symptoms.
Right.
Yeah,
Yes.
the other thing you'll find there's so much emotional distress. And this emotional distress and anxiety can manifest itself in terms of the physical symptoms.
Mm-hmm.
The woman feels pain and sometimes headaches, sometimes chest pain, sometimes even difficulty in breathing. And it's one of those, if it is persistent for a month and above, it can be an indicator that there is something not well
Mm.
with this lady.
So the key thing here is that must be a month and above, and not just because today I'm feeling for a
No,
week. Okay.
no.
All right, Mike.
Yes. And also, like we continue on the physical manifestation, the
Mm.
physical activity is either gets exaggerated or it gets to be so low. This person is like morbid, and it really affects them on a physical level in
Right.
terms of activity. Yes.
Right.
Yeah, and at times there is so much feelings of guilty within this woman. There's so much regret. Why did I even give birth?
Mm.
There's so much of hopelessness in their minds. They feel alone
Mm.
because they are feeling like they are not the persons they used to be anymore.
Mm.
Even their talk, they talk negativity is so much high in their speech. So we
Sure.
need to be very attentive to hear such type of things to be able to detect that this person is going
Mm.
through PND.
It's interesting to think that somebody would have perhaps gone through a joyous pregnancy, they can go
Yes.
through that.
Yes.
at the end?
They can, if they are overwhelmed,
Wow. Okay.
they can get through that.
Mm.
And you can also be in a position to try and see that this person is going through PND because their way of concentration is depleted, such that the guilt that they are feeling may not be having any reasons why they are really feeling that way.
Mm-hmm.
It just comes and it overwhelms them. And some of them may even end up thinking that, no, man, I need out of this relationship. No wonder you find at times, soon after birth, you hear so and so they've separated
Right.
without realizing that it is not because they don't love one another.
Okay.
This woman is going through PND, which is overwhelming them,
Mm.
and no one realizes it.
So they didn't
Yes.
deal with it.
Yeah.
Like,
And I think something that may be worrisome to the family is that this person who was sober-minded, very rational, starts to be irrational in their thought pattern, and it does confuse the family as to is she becoming psychotic? Is what is happening with the mother? What is happening with my wife? And it becomes a big challenge
Mm.
where they begin to exhibit irrationality
right.
sometimes in their thinking pattern. Yes.
Sure.
And they can also sometimes lose appetite
Mm.
or suffer what is known as anorexia,
Right.
where this is an eating disorder. Sometimes they eat and they even can induce themselves vomiting.
Really?
Yes,
Mm.
because it's like they think, why did I eat it? And yet they wanted to eat that thing.
Mm.
And sometimes they look at themselves, the body built, it frustrates them that,
Because you change, obviously, during pregnancy.
yes.
Mm.
So they have these mood swings that just overwhelm them. And people around will be just laughing and say, look at what she's doing. They little do then realize that this person is actually exhibiting symptoms
Mm.
of PND.
Sure. I've never realized how complex PND is. Mike, any other additions?
I think I'm exhausted on my
Uh-huh.
point unless
I,
Chris has something.
you find also that sometimes soon after birth and within the period of a month, there's persistent feelings of being fatigued.
Mm-hmm.
They don't want to do anything. They don't even want to go outside and meet with their friends.
Right.
And they feel so sad, even when people come and say, congratulations. They may not tell you that I'm feeling sad,
Mm.
but inside them, they want you to see this baby and go away and leave them.
Right.
And they feel so much overwhelmed with this little baby.
Mm-hmm.
Do you know it has a lot of challenges, PND, and we really need to let people understand that when you see these symptoms taking place, the first and foremost thing that they have to do
Mm.
is to go to a GP,
Right.
their general practitioner, so that they are helped to have a full diagnosis
Mm-hmm.
whether really they are getting into such a challenge.
Right. So now, what causes this? Because this is something that, from my mind, comes from Norway. What causes PND?
There are quite a variety of causes,
Mm-hmm.
and depending with the extents each person may take pressure, because some of the causes may happen during pregnancy.
Okay.
What is it that was happening during the pregnancy? Was this child or this woman exposed to maybe rape?
Okay.
If the pregnancy was due rape, they could be suffering that pain, that guilt, that anger within them, which then it reveals itself when the baby is born
Mm-hmm.
through PND.
Sure. Mike.
Another risk factor is when there is a poor marital relationship during pregnancy. It really does offset this particular woman.
Mm.
Instead of celebrating the new arrival of the baby, you still have to respond to the challenges
Mm.
that were taking place in terms of your marriage and what was happening between you and your spouse.
So the woman really needs a safe and secure environment while they
Yeah.
are pregnant.
Yeah, definitely. We'll get into that.
Yeah.
But
You know, stress, overload of work. It could be there's joy at home, but maybe this woman is working in an environment that is very pressurizing, that has so much overloads. So they work under stressful environment, and it may end up also affecting them, leading them to depression, which is before giving birth.
Mhm.
So their pregnancy is being nurtured or it's developing in a situation where there is depression already on this woman. And the possibility is after giving birth, they get into PND.
Mm.
Yes.
Mike?
Yes. The other thing is if there is a history
Mm-hmm.
of depression in the family from which this woman is coming from, sometimes pregnancy does trigger, and it may then turn itself into being postnatal
Right.
depression.
Right.
Yes.
And at times, someone may give birth very well, coming from a very happy environment,
Yes.
and they are looking forward to having their baby. But lo and behold, they give birth to a child who is a special need child,
Yes.
a child who is going to need medical attention every now and again. That can cause a lot of stress on the mother, and it can lead to PND. And believe you me, this is a situation, even without a child being a special needs, there are those people who will be looking forward to say, I want a baby girl. And
Yeah.
the husband
Yes.
has been
Yeah.
pushing, the relatives have been pushing,
Yes.
we want a baby girl or a baby boy per se.
Right.
So come delivery day, they discover it's a girl or it's a boy,
Yeah.
the one that they didn't, the sex that they didn't want.
Yeah.
That can bring so
Sure.
much trauma, and it can cause someone to get into PND.
Sure. Mike, any additions, please, on the causes, or we've established?
Yeah.
I'm
Just
sure there's more,
the-
but
Yeah.
for now, that's what we can do.
Yeah.
Now that we have established what the causes are and the symptoms, what's the impact that PND has on the family?
Okay.
Yes.
Mm.
Because the mother is going through this kind of depression, there may be a seriously reduced interaction between the mother and the newborn baby. And because of that, this child also goes through some kind of emotional stress because they are not getting the kind of attention the mother should give. And the long-term impact of this is that you may find that it may reduce intellectual development, where the IQ of this particular child is reduced.
Right.
Yes, even up to 11 years and above and whatever, the child can still suffer from intellectual development
Right.
because of lack of care, lack of interaction
Right.
between her and the mother.
Right.
Yes.
I think let's just take a quick break, and then when we come back, we'll just talk further on the impact that this has on the family. Seems like a very serious and broad
Yes,
subject.
yes.
Don't go away. We'll be right back after these short messages. Welcome back. If you've just joined us, you're watching Family Matters, and today we're looking at how to cope with postnatal depression. Liz, before the break, we're looking at the impact that PND has on family members. For those who are just joining us, we said PND is postnatal depression. So, what other impact does it have on the family?
Mike was just explaining how the child can be affected in terms of intellectual and information processing. But it doesn't just end there. It also affects the development of how to behave, to self-control yourself in their behavioral interactions. No wonder sometimes you'll find this child doesn't know how to self-control. Any little push, because anger that was in their mother has been put in this child. So they don't have the art to be able to control themselves in the way they respond to the events around them. So their behavioral development is highly challenged because of PND.
Sure. Mike?
I think when you look at impact, the impact is not necessarily on the newborn child. The impact can also be on the husband or on the, let me say, on the marriage itself. It may not be surprising that immediately after birth and the woman is going through postnatal depression and whatever, and the husband fails to adjust or to adapt to the challenges the wife is going through, and they may not understand it as postnatal, but they may think of it as possibly social challenges or something is happening in our relationship, and the husband leaves or the wife leaves or something. The marriage itself tends to suffer
Right.
if people don't understand exactly what this woman is going through.
Right.
Yes.
And despite that, you may think you have passed the PND period where the wife was suffering PND, it leaves this woman vulnerable to other forms of depression that they will suffer their levels of depression more than any other non-bearing woman would suffer, because depressions have different types. So if you once suffer PND, you are more likely to even suffer more on other types of depression than a woman who has not suffered PND.
Right.
And it makes it very, very difficult because it can run for even periods more than a year, 2 years. And
Really that
if-
long?
yes, within the period of 5 years,
Mm-hmm.
you may find yourself suffering different types of depression because you once were vulnerable to PND.
Sure. Mike?
Yes. Still at a social level, um, the impact may be such that relatives or sometimes parents, we have some kind of cultural beliefs, may tend to believe that maybe this child of ours, daughter of ours, was bewitched.
Right.
There is a witch who is, she's being hated, and or maybe our spirits were not happy. We need to appease them and whatever. So instead of addressing it as postnatal depression, it is now uh, connected with some beliefs, and this woman must now go through some rituals and other things. So instead of treating the problem and managing it the way it should, then you find now you are dragged into this witch doctor, into this traditional healer, into these consultations and what have you. And at the end of the day, man, it simply worsens the problem
Right.
than solve it.
Right.
Yes.
And it has also effects or the negative impact on mother-child bonding.
Yeah.
Of course.
This mother, because of the way she is feeling, she has no time to really pay attention to the needs of the child. If a child cries, it actually irritates her. And sometimes you will find she can even push the child to the corner, and he has nothing to do about the cries of this child, such that there is so much distance between the mother and the baby. Yet soon after birth, this is the time for bonding with your child. This is the time you need to have the child know that this is my mother. But because of PND, it robs that to an extent that the mother can even kill this baby, strangle this baby,
Sure.
because the cries of a baby irritates her so much. Or the mother herself can contemplate suicide because they are so depressed and they feel so alone. Everything around them, nothing seems to be good. They no longer want to be within the people they used to love, including the spouse. They may not even want him there. There is so much accusation, so much negativity that goes around, such that if the spouse is not aware that this is what is happening, the spouse may even think that I think we don't love each other. They become the husband may even stay longer away from home instead of him maybe knowing and coming closer to assist. People never talk about it. Hence, people are caught within such a situation and things are just left deteriorating than finding ways of helping.
So if this thing is dealt with in the beginning, it can really solve fatal things like someone actually killing or strangling the baby
Yeah, and
Wow.
committing suicide.
and committing suicide as well.
Yeah,
Yes.
they have so much suicidal thoughts, people who suffer PND. And
Mm.
if there is no immediate intervention, who knows, they can even end up
Yeah.
carrying up that thought,
That
and
thought.
they kill themselves.
Mike?
Yes. These people are not totally unaware of what is happening. So, to some extent, because they are now aware that I don't know what's happening with me, there's this tendency of wanting to feel, they tend to lose self-esteem and confidence because you don't know exactly why am I behaving like this, and they too do not explain it as postnatal depression. It's something maybe the psychologist knows or counselor
Yes.
knows, but they cannot put head and tail to it. You get the point. But they get ashamed of themselves. Why am I behaving like so? There's a tendency of losing confidence in self, which then lowers self-esteem.
Mm.
Yes. And again, if I can just also add, I'm a pastor,
Mm-hmm.
and I'm glad it's a pastor who is saying this. You know, there are times when we as believers think that any challenge that goes on in somebody's life is demonic.
Mm.
Yes. That woman, she has demons. She has demons. We need to pray for her. They come to pray for you. In the name of Jesus Christ, get out. They are trying to chase out a demon from this person. We need to know that it's not everything that we go through that is
Yes.
demonic. People
Yes.
need to know the psychological implications of life.
Mm-hmm.
Yes.
So
And not
okay.
only do we talk of the baby being affected, PND affects everyone within the family.
Mm.
The children that are already there, maybe some other toddlers that are already there,
Mm.
they highly suffer rejection, and the mother doesn't
Yes.
want to have anything with them. So much that if not addressed properly, because of the way this mother now is treating this child who has already been there,
Mm.
lashing at them, displacing their way of their anger on the little babies, these children may even end up being so jealous. They think mommy now loves this little one more than
Yes.
us.
Yes.
To an extent that if it is not properly monitored, you will find a toddler strangling the baby because they feel overthrown, dethroned by this baby.
Mm.
And yet the baby is innocent, but the way the mom is doing it
Mm-hmm.
is such that she's pushing everyone away,
Mm.
and it affects the whole family.
So now, Liz, just tell me something now. If family members find that no, the woman is having PND, how can they help? Is there a way of intervening to help them to get back to a state of feeling well again?
There's quite a lot. That's why we are talking about it.
Mm.
Because the more we make people aware, they'll be able to find ways of assisting. But let me give precaution. Like I have said before, you need to see that these behaviors or these symptoms we have been outlining are persistent within a month.
Mm.
Then if you notice that that is what is happening, you need to first of all go and see the GP, your general practitioner, so that the general practitioner will diagnose properly and get a full run to see whether this is what is happening.
Mm.
And then the general practitioner will then have to refer this person to a counseling psychologist if the situation is still such that the person is able to reason and talk. But if the situation is that it has already deteriorated,
Mm.
the GP will have to refer to a clinical psychologist who will need to do medical intervention where they have to administer medicines, drugs, to try and control the hormonal misbalances that may be affecting this woman to do that. Unfortunately, some GPs, they may keep letting you come for medications and whatnot, and
Mhm.
by the time they refer you, it may be too late.
Yeah.
But basically, this is what is supposed to take place.
Right.
So once the GP confirms that this is what is supposed to be done,
Mm-hmm.
you are supposed to now take this intervention that you can do within the family, one of which is to give care
Mm-hmm.
and support.
Mm-hmm.
Be there. Try to make sure that you encourage this person to take their bath.
Right.
Try to make sure that you are there to also make sure that this woman is made to feel that she is still very important.
Yeah. As you're talking, someone will be thinking to encourage them to take their bath, but I'm sure at this point you've got no interest in anything, including even taking a bath. All you
Yes,
want to do is just be left alone and
yes,
do nothing else.
yes.
Yo, Mike.
Just to add, I think at this point it's also very important that should this woman belong to some church or
Mm.
religious organization,
Mm.
while you may pray, it is still very important that a medical opinion be sought.
Of course.
Don't just end with, we know prayer moves mountains and God created prayer, God answers prayers. But it is also God who created doctors,
Right.
who created other forms of interventions. And we need to appreciate, we need to have a balance. Let us pray about it, and also at the same time, like Liz is saying, let us seek medical intervention.
Yes.
And one thing that I would like to kind of propose is that let us understand that this woman who has given birth is going through a lot of psychological, emotional, physical changes. This is not the time to condemn, to be negative, to be negatively critical, to be judgmental, and to be perturbed by why is he behaving like this. This woman at this point, she's not looking for that.
Right.
She's looking for love. She's looking for care. She's looking for people who understand. But she may project herself maybe in the opposite.
Yeah.
But let us be careful enough to know that a person who has given birth, whether there is postnatal disorder or there is not, they need time to adjust to their
Yeah.
normal level again. And it takes a lot of journeying with them to that normal homeostasis again.
Right.
Yeah.
Liz, because of time, what are the last few words that you can just share with us? We've just 30 seconds left.
I think we need to be able to be there, to be supportive, and to
Yes.
make sure this woman is not overloaded with work.
Exactly.
Take time to take the child away from her so that she rests. But in most cases, after she rests, try to to make sure that she is with her baby,
Right.
so that they bond. And you encourage her, you give a positive affirmation, be supportive, cuddle her as a husband,
Yes.
help her to feel herself once again.
Right.
Take her out there.
Beautiful.
So there are a lot of things that are positive that you can do within a family
Yes.
to bring about full healing to this person,
Right.
and it can be done.
Thank you so much,
And
Liz.
remember also God.
Yes.
Pray about it in
Yes.
all settings. Pray so
Yes.
that God intervenes in everything.
Yes, we can never underestimate the power of God. God
Exactly.
is able
Yeah.
to deal with any
Amen.
kind of situation.
Amen.
But thank you so much, Liz and Mike, for thinking about this topic, because it's something that's very important. And I'll encourage our viewers as well to read more about it and contact you if they have any other questions as well, because it's something that's serious and can have fatal endings if not dealt with early. Thank you so much for staying with us. We've come to the end of our programs. But if you have any question about this topic, please write to Liz on the details that are on the screen right now, and she'll write back to you as soon as possible. Until next time, goodbye and God bless.